Well, good afternoon, everybody, and welcome to another version of one of our training seminars. We've gotten to the point now where we've done an awful lot. We've actually walked through the AHIP process. It's not an easy test, but it's something we have to do every year. The certification process is also kind of a grueling process, but again, it's just something to come to know everybody's products out there. So it's important.
Yeah.
Important.
Yeah.
As well as that is that we help determine what carriers. We actually have a CMS dashboard that we can have access to, folks, that will help determine what you want to select as different carriers. We can tell people, we can filter it down to a county and tell them exactly what's been sold, how many different products have been sold, and kind of give them some direction on what to do when it comes to certification process. So this is for the MedSup carrier, the MedSup producer out there that is looking to dip their toe or come diving into the pool of the Medicare Advantage.
Mm-hmm.
I think we've given enough data that says that the Medicare Advantage is not going to go away for certain. And
Only getting better every year.
Every year, more and more dollars are being spent that direction, and it sure looks like it's going to be the avenue in which a lot of people are going to be going in the future. So besides the AHIP and besides determining what carriers, we've also got a lot of good marketing. How do I get in touch? You can touch your clients anytime you want to, as far as going out and telling them what you have, that relationship. You can go to them and tell them what you're up to, do seminars, do videos, webinars. You can do just pretty much what you want to your clients themselves. To the prospects out there, we got to kind of watch a few of the guidelines that are going on, stick to some compliance.
Mm-hmm.
Like we talked last week and in previous weeks, compliance is our friend, but we've got a lot of marketing pieces out there. Letters, generic letters that can go out. We've got postcards that can go out, and social media posts that can go out. So
All compliant.
All compliant, already worked up and ready to go. Last week, you and I did the phone, some of the cans and can't do's on the phone. Outbound phone calls to prospects is a no-go. Returning phone calls is we can do that all day long. Again, reaching out to people that have reached to us or your own client base, completely legitimate. And again, if you need any more reference, go back to those videos inside our vault and review some of those and go through some of the Medicare rules and guidelines. Today, we're going to be actually doing a demo going from start to finish with both MedicareAPP and MedicareLINK.
Yep.
Two different platforms. Why don't you expand on that just a little bit?
Yeah. Well, first, elephant in the room, the jersey.
Start explaining yourself.
Yeah. So
explain yourself.
I honestly forgot we had this webinar, else I would have brought a different shirt, but we had the, what do we call it today? The spring training through Integrity, where we go over training and compliance and all that stuff. So we had Jersey Day, we did a cookout. So I was on the grill. So this is what I had, and we had jalapeno cheddar Polish sausages. So
you did well, by the way.
We're in a small room, so this webinar could get interesting. But no, let's proceed today. Like Steve said, we're going to talk. Not necessarily get in the weeds, but just for MedicareAPP as well as MedicareLINK, how to talk to somebody, do the scope, get their good information in there, and actually do the enrollment. We're going to do that on MedicareAPP and MedicareLINK.
You and I made an interesting discovery yesterday. Most of the carriers happen to fall on the MedicareAPP.
Yeah.
There's a fewer amount of carriers that are set up with
MedicareLINK. Yeah.
What we discovered, I'll let you expand on this, but go ahead.
Yeah. So what we found, like during last AEP, was the first time we really brought this MedicareCENTER to the table.
Yep.
MedicareAPP is really what most of our agents used, and I think the reason is just more carriers.
That's right, the volume of carriers
were available there. So I honestly, personally, never really used the MedicareLINK. So last night I was kind of
we both were
messing with MedicareLINK a little bit more, diving in, and what we found out is it really is user friendly. So it really is what we're talking about today. Both options.
I think we're even going to do a demo on the scope of appointment on at least MedicareLINK.
Yeah, we'll do. I think we did the one on MedicareAPP.
We've done the MedicareAPP already. We've got to show you this MedicareLINK. It literally is the best thing that I've ever laid eyes on. So we'll get to that, but stay tuned for this, because again, Both options are available. You can use both of these tools. So basically, I didn't mean to interrupt. Go ahead.
No, let's just go and we'll get going here.
MedicareCENTER itself, again, we've got scopes of appointment that we're going to be working through today. Again, I was impressed with the MedicareAPP scope of appointment, but I'm really impressed with this MedicareLINK scope of appointment.
Yeah.
You can use either scope of appointment system and write through either one of these plan designs.
Yes.
I mean, everything's going to be held for a compliant amount of time, whether you write something or not. Even if you enter into a conversation and you need a scope, you can do it. If nothing gets sold, it's still going to be stored in a timely fashion, not something that we readily could have available if we had to print one and say, boy, that client, I can't remember even where I put it. You may be still asked in the future to produce that. We've got plan comparisons, and we're going to go through that once the scope is getting taken care of today. We're going to show you plan comparisons, the quoting tools, the enrollment tools. And again, we're going to expand upon the universal login, where there's one login and have absolutely everything at your.
Yes.
And the CRM tool, this client retention manager, is getting better.
Yeah.
Getting better. I think there's some better formats out there, but again, it doesn't lack for much.
No.
It's a great little tool. So on to the next one, Jason, please. Go ahead, you can take this one out.
So again, we say this every webinar, but we want your business, right?
This is one of the ways we get it.
And so we had to kind of come up with something, and it really through integrity, we're able to get this platform that's just, once you use it, it makes your life so much easier. And it does cost money. It costs a lot of money. But the good thing is for you guys as agents, as long as you do business with us, have your carriers with us, the cost for this MedicareCENTER is free to you. So we just ask to partner with us. It's our job to help support, and we're doing everything in our power to make sure that we have the tools to make sure you guys are successful.
If you have any of these contracts with other integrity partners, all of them are going to show up on your MedicareCENTER spot.
Yeah.
Accessible through the link here with New Horizons. So does not, we of course want the business, but if we have a couple of products and you've got a couple of products with Agent Pipeline or Nishlosh or SMS, those are all our partners as well. All of those products are going to show up on the MedicareCENTER under your name. So it's not like you're going to have a bunch of different MedicareCENTER enrollment. It's not like that whatsoever. It is so user friendly. A little bit of a curve. Your dad and I are challenged in this arena, but I can tell you the more I get to use this product, the more I absolutely love it.
And honest, I think I've said this before. I'm young. I'm 32.
Mm-hmm.
I feel older than that, but I'm 32, so I should be good at technology, but I'm not. But really, this is still fairly easy for me to use and user friendly.
This morning we went through a number of tests on that scope inside that MedicareLINK. I think I have found a new way that I'm going to be doing the scopes of appointment. This is absolutely the slickest thing I've seen. So, okay, today we're going to master the enrollment process. Okay, so this is after we've gotten onto the telephone and we determined that we need a scope. So what do? You're on the telephone, Luke, with that particular client. Say it's a client that we know that we've got. We still need to cover our tracks with a scope.
Yeah.
So you're talking to this person. Take us through the system.
All right, Jason, do you want to switch over to my computer and show it, or we can get through this slide first, then I think we'll go over. But within MedicareCENTER, there's two avenues. The first avenue is MedicareAPP. The second avenue is MedicareLINK. Okay, they're both in the system. They're going to get you where you want to go. They're a little bit different. Some of them have different functionalities, I guess, but they're both going to get you the same. I think we use the analogy Pepsi and Coke. They're both good, but
sometimes you have loyalties one way or the other,
right?
But not always.
Right. Right now, I believe MedicareAPP does offer more carriers. I think that's why. I promise you it does. That's why more agents have used that. But if you are offering a carrier that is available on MedicareLINK, that could be a really useful option as well. So I'm going to share my screen and we'll kind of, if I can do it right. I told you the technology piece is not the best.
We're going to be fine.
All right. Are we good?
Mhm.
All right. So we always start right here at our website. Okay. So kind of how to get to Medicare Center. You'll punch in New Horizons mktg.com, the abbreviation for marketing, and that'll take you right to our home website. And then we made it really simple. Here at the top, there's a big button called Medicare Center. And if we click that, that's going to take us to the Medicare Center landing page. And if we scroll down, there'll be a button here. It says log into Medicare Center. So we're going to do that. And I've already logged in, but it'll ask you your username and password to get in. I believe the username is just your NIPR number. Then I'll have you create a password. But once you get into the system, again, through Medicare Center, really the component that we use a lot is the MA and PDP. So let's click this. And this is where it gets us to our two options. So Medicare app, MedicareLINK, we've talked about. We're going to go over MedicareAPP here first. So we click that, it's going to pull up MedicareAPP. Okay. And again, today, I don't want to get in the weeds so much. There is a lot. What I would encourage you to do is, we're going to go over this. This webinar will be saved. That we'll have a library on our website that you can go back and watch it again if you get really bored, and can look up some stuff.
So they simply just fill in the search beneficiaries. I mean, this is what they do.
So if you already have a bunch of people in here, you can easily punch them in by whatever their last name is, first name, or whatever, and it'll do it. But first thing I always like to do whenever I'm talking to somebody is come up here and I punch in this Jason. Okay, let me get that out of the way. New profile. Okay, so we're going to start a new profile. So I'm talking to, let's say, we'll say Joe Tests. Okay, and so we're going to get as much information as we can. So we want to type in a zip code. So I'm going to type in just our zip code locally here. And really, the more stuff you can have in here, the better. All you need to enter a person is the zip code, first and last name. Okay.
So that's the minimum amount of information.
That's the minimum amount of stuff that you need.
All right.
But the more you have in, the more of a profile that you're able to build on somebody. So what I always do at minimum is I'm going to type in zip code, first, last name, and then also a phone number. So we're going to use, I'm just going to, Jason, what's your cell? Sorry. 620. Okay.
1610.
Don't write this part down. Okay. Then we're going to go down here. And I always, before we really get the conversation going, we're going to start with the scope. Okay. And again, continue to SOA. As you can see, since I had the number in there, it's going to automatically pop that number in there. Just for timing reasons, we're going to really talk about the scope on MedicareLINK, but we have done this before.
Self-explanatory. So you can go back to the library and find this one. We've done this one in-house right here.
Yeah. Okay. So really, all you press text, or you can email if they're here in person. If you wanted to, you can print out a form right here. But get the scope done, and then it does store it in your little CRM tool available on MedicareAPP. Okay. So we're going to say we got the scope for Mr. Joe, and we're going to continue to plans. Okay. This is a test one, so we don't have everything in here, but we're going to say we're going to talk about Medicare MAPD. Okay.
Sure.
So as you can see up here, since I typed in this person, I sent him the scope, his profile is up here. Okay. So we can look at his profile. We can look at the scope, preferences, health, prescriptions, all of that up there. And it's
all stored inside that
right there for him.
In that CRM tool.
I always like to do the preferences, once we get going, before we actually look at the plans. I'm going to type in his prescriptions. Okay. So we're going to look at add preferences. We're going to say we're going to talk about MAPD. We're going to say he does not receive any sort of help. Continue. We're going to say Mr. Smith is between 65 and 69, and he's pretty darn healthy. Okay. What this will do here on this system is it doesn't change the quotes, it doesn't change the plans, but it'll give you a little bit more of an accurate reading of what plan and the usage that Mr. Joe has will help with choosing the right plan for him. So we're just going to continue this. We're going to add in his prescription. So I'm going to say he's on metformin. Let's say he takes 500 milligrams twice a day. Okay, and then we'll add in another one. Let's say we'll do blood pressure. So let's say lisinopril, and we'll say he takes 20 milligrams once a day. Okay, so he's on 2 medicines. So you can see your Mr. Joe's prescriptions are right up here, and we're going to continue.
Really simple stuff so far.
Then it goes to pharmacy choice. So we're going to say Mr. Joe likes to go to CVS, but he's open to go other places. So we're going to compare. We'll compare Walgreens with it, just to see what's best for him. Continue. All right. So now we get to the plans. So again, I don't have all the plans available on this system, but this is we'll give you an example. So it's going to sort it. You can sort it for plan premium, the total estimated costs, estimated drug costs, star ratings, or just simply the plan names.
And it looks like anything else, the more we use this, the easier it gets.
It does.
I mean, it really is nothing complicated about this other than keeping your mouse in front of you and just kind of using some preferences that you'd like to take a look at.
Yeah.
I like it.
So scrolling down, again, it's going to go from least expensive to most expensive. So we're going to take a look at.
He likes that.
We're going to take a look at this Aetna plan here. So we can do plan details, and it's going to tell you everything you need to know about the plan. So the costs. It's going to talk about the benefits. So it looks like he's got a $5 primary care copay, $40 specialist, the biggie, $300, days 1 through 5 in inpatient, and so on. Okay. If we scroll down to the bottom, okay, this is where we can look at the provider directory. So each one of these plans has this at the bottom. So we can click here. It's going to take you to another, it's going to take you directly to the carrier portal, and that's where we can look at.
So if I use Dr. Rademacher, we can look Dr. Rademacher up inside this.
We can.
And go from there.
Yep. Mm-hmm. Yep. And then if we keep going down, it's going to talk about the prescription. So we can look, both of Mr. Joe's prescriptions are covered, and CVS or Walgreens. He can go either. They're both the in-network plan. So once we figure that out, okay, and we say, okay, this is a good plan, add to cart, okay, or you can send a quote. Okay, so you can send a quote so they can look at it, and you can do that by email or text.
Okay, so it goes either way.
Yep. But we'll say, okay, Mr. Joe says, Luke, sign me up. Okay, we're going to add it to the cart. And then right here is where we apply. So that'll just take you directly to the next page. I'm not going to do that today, but.
And so without leaving this website, we can look at both. I saw Humana was in there as well. So if I wanted to bypass that and I had a bad experience with that and I go to Humana, it's going to give me the same preferences and everything about that. So
yes.
I don't have to get out of Aetna and then go to Humana and log in there. Right. I've got all of that sitting right there, just ready to help me out.
When we talk about the universal login, to me, I'm not a very organized person. It helps. So, before we had this, or before we had this, I had, this carrier favorited, this one, and
all of them. You clicked on one to the other one and just kept navigating through that.
Time consuming. So with this, as long as you know your NIPR number and a password, you can get in. And we just really looked at Aetna today, but every carrier is going to have pretty much the same thing. So
time is money to our brokers out there. Time is money.
Yeah. So that's Medicare app in a nutshell. I know we're kind of on time constraints, so we're gonna we'll go back to the homepage of Medicare app, and we're gonna take a look at MedicareLINK. Okay, let me try to get. I don't know if you can see that, but okay, I'll just worry about that. Okay, so we're gonna go to MedicareLINK. Okay, so as you can see, it's a kind of a different interface, but it does the same thing. Okay, you know, here at the top we have the quick links, so you can search your contacts, you can quote and enroll. This is where you're going to send a scope, and you can do some reporting. So the kind of the four main buttons. So I put in a few of these just last night that we can look at, but always the first thing that I do, no matter what system we're on, is I'm going to create a new contact. I'm going to get a person there. So we're going to do the same thing. So we're going to say we got, let's say, if I could spell, we're going to do Robert as a test. Okay, we're going to say same thing, 62526. We're going to use his number, which is
217-620-1610.
Okay, don't put his email. We're going to say he's, let's say he's turning 65 in June. Okay, so we're going to save him. All right, and then we go back to the home screen. We can look at my contacts here. You can either search contacts or the ones that we just did. So we're going to pull up Robert Test. We click these three dots, which is the action tab. First thing we're going to do always is we're going to send a scope. Okay, so you can see he's up here again, kind of the same thing that Medicare app uses. The person that you're talking to or the person that you're working on, he's gonna be up there at the top. Okay, so we know we're working with Mr. Robert, and Robert is very tech savvy, and he has a smartphone, and he texts his grandkids all the time, so he's comfortable here. So we're going to text him a scope. Okay, so this is a little bit different. Okay, but really I like it. I like it a lot. So we're going to say with Robert, we're going to talk about standalone Part D possibly, and maybe a Medicare Advantage Part D or MAPD.
Now your client here can be on the phone. He can be in front of you anywhere. This is an anywhere tool.
Yeah, anywhere.
Anywhere.
So even if he's sitting here in my office, this, whether it's Medicare app or MedicareLINK, is so easy, so fast. I still use this.
Yeah, we don't do the paper stuff anymore because again, digitally, this stuff will be held for the appropriate amount of time, and there'll be no sense in.
Yeah. So you can see here, got my agent, and then we have Mr. Robert, and then his phone number there. I'm going to skip the address. We're going to say Mr. Robert walked in to my office, and we're going to say we're going to talk about all the options. What's today, the 5th?
Yeah, Cinco de Mayo.
Cinco de Mayo. Yeah. Okay, so once we get that, the only thing we have to do on these scopes is everything that has an asterisk. So if it has an asterisk, we got to fill it out. Okay, we scroll down to the bottom, and you just simply press text. Okay, his phone number is automatically going to pop up, and whenever I send this, are you going to be able to pop your phone up?
Mm-hmm.
Okay, so we'll see what Mr. Robert sees when I send this. Okay, so it'll take just a second. And then
So that's how it looks for the agent.
This is how it looks for the agent. And then whenever we get the phone popped in here, that'll be what the consumer sees.
Mm-hmm.
On the agent side, you'll see this personal code. Okay, so we're going to need to know that.
Okay, let's switch screens. And run over.
So this is going to pop up here. Okay, so it's going to say, please click the link below to electronically sign the scope. So Mr. Robert, if you could click that blue link, would be great. It's going to pop up.
That's
What is the code?
I should have wrote it down.
How's it gone?
It's gone.
Huh.
Okay, but this is what the client sees. Okay, and then so go back to my screen, I guess, so I can give you the code. But all
You can still switch to it.
I can. I told you, 32 tech savvy.
I think that number's going to be right behind.
Okay,
864 722.
722. Yep. And then press continue. Okay, and then Mr. Robert, all you have to do is scroll down a little bit, and in the top line there will be a signature, and all you do is type in your name. So we'll say Robert Test. Okay, and then all you're going to do, Mr. Robert, is scroll to the very bottom and press save.
Just let everybody see all this.
Mm-hmm.
Disclaimers and save.
Save. Okay. And then,
And as you can see, it says, thank you, Robert, for completing the scope of appointment. It's that simple from your prospects. Unbelievable.
Let's switch back to yours.
yep.
Got it.
Okay. So, can you
You
see?
don't have to hit share.
Can you see my screen?
No.
Okay. All right. So then once we see this, so Mr. Robert submitted it. He's pressed save. So we're going to, all we have to do is refresh. Okay. And then we're going to go back in to Robert. We're going to look at his profile. Okay. And we're going to say he did submit it, and all we have to do as an agent is press sign. Okay. So it is signed, it's completed, and we can view it right here. And then we have the scope of appointment. So that is.
And so even going back and forth like this didn't last 3 minutes.
It didn't.
And so in the context of working with somebody with a texting capacity, this might take maybe less than 2 minutes.
Yeah, super easy. And again, it stores it, so you have everything, and you know, if Big Brother comes back at
Yeah,
you have it all saved right here.
Yep.
Okay.
Okay.
So once we have the scope done, okay, let's go back and kind of the same thing. We're going to look at just the plans that are available. Okay.
Yep.
So click home, our contacts, quotes. Okay. So we're still looking at Robert up here. Again, these are some of the plans for the Medicare Advantage MAPD. You can sort it however you'd like, but it has all the plans.
Same as what
available.
we had. Yeah, same as what we had before.
Right.
Mm-hmm.
This one, for whatever, I'm
Okay.
honestly not sure what, but this one shows everything. Okay.
Perfect.
So, you know, there's only a few that this test account is enrolled with that we can enroll, but kind of the same thing. So there's a couple different functions here where if we say, you know, the same thing on the Aetna plan, we can look at the details of the plan.
Mm-hmm.
Okay, so it's going to show us, you know, everything that there is, the summary, outpatient, inpatient, prescription drug benefits, all the plans, all the details on this particular plan.
Super easy. Again, one-stop shopping for everything that we've got available is
Yep.
right here.
Everything.
No
you
more
need.
leaving and coming back. It's can flip-flop going back and forth with the different plans.
Right. We can still, we're under the same person. So, you know, we can add medications, do it right here as well to get a little better understanding of costs. So we'll add, let's do the same thing. So metformin, 500 milligrams, we'll say twice a day, add that to his profile. Over here, we can also look at the health, kind of does the same thing again. It doesn't change the plans, but it'll give you a little better understanding
Sure.
of usage.
Exactly. what's going to be best in the event that they go to the doctor
Exactly.
a lot or just a few times.
Exactly. And again, to build the profile, we can get his primary physician, specialist,
Right.
whatever in there, make sure that we're in network.
And the more we use this, the better benefit it's going to be. I mean, it's going to be a go-to resource.
Yep. So, and then again, this is the one he wants. All we have to do is press enroll, and we're off to the
And the
application.
application is right there in the whole process. So we can
Yep.
sign, seal, it's off to the carrier. The scope of appointments already handled and solved.
Yep.
And we can say goodbye to our client when we've done the necessary dotting the i's and crossing the t's on the conversation.
Yeah. Yeah. So guys, I know we're trying to
Right
keep
on,
it under
we are.
a half hour.
Yeah,
So
we're there.
and I know we kind of went fast, but again, you can go back and watch this again. But I encourage everybody just to get on there, create a username, create a password, and just play around with it. I really think that's how you're going to learn and really just jump in there and look around.
We're going to take 30 seconds and talk about how you and Sarah do it. Again, you take care of the phone conversations. We have a licensed agent that's in touch with what you're doing. You ship it off to Sarah for the enrollment piece of the equation, and you're on to the very next one.
Yep.
During AEP, that can be totally invaluable to all this.
It is. I would, again, I think we're talking to a lot of med sup first
Correct.
people, and
Correct.
that's what I would say
Yeah.
I am. And like Steve said, how we do it in the fall when time is money. We set our appointments. I'm on the phone all day, every day. We set them every half
30
hour.
30 minutes.
And I'm doing the scope. I'm finding out, what plan is best for
Yep.
them.
Yep. So
Talking
everything's
to them.
compliant,
Mhm.
shipping it off to a licensed broker that we're sitting there filling out the rest of the application, and we're off to the
And
races.
I'm on to the next one. Yep.
So folks, if you're looking to economize your time, where time is money, wonderful tool right here where it's everything, whether you're talking to that person over the phone or talking to a person live in your office. The only comment that I've seen up there is that you ought to be in a Steelers jersey. I'll say that one. That's the one I saw. But do we have any time for can you pick a quick question there, Jason, just to let us?
Yeah, Jeff is asking, do you still give a paper copy to the client?
Of the scope?
Not sure. I think with any of that,
There
you-
is some
you
leave
could.
behinds. Yeah, there's all kinds
Yeah,
of, there's leave behinds, of course, that can be printed off this, Jeff. Then the answer is yes. That you would definitely could make a copy and leave anything that is pertinent to the sale.
Okay, and Jeff's asking how to set up a username. So when this webinar is over, your browser is going to open and take you to the MedicareCENTER page. And when you click on that, there's going to be a link there to register. So if you have any trouble with that, just let us know. But it'll take you right where you need to go.
And they can take it from there to sign up for MedicareCENTER, Jason? Is
Yep.
that what they can do?
Exactly.
Okay, there you go, Jeff.
Jules, which of either of these is used for Lasso?
Lasso is not on this, Jules. Unfortunately, it's one of the plans out there that was not included with the MedicareCENTER. So we still have to default and go to the lassohealthcare.com website to do that enrollment. So unfortunately, both are easy though, as you well know.
And Shannon just commented on Jeff's question. They will be mailed a copy of the app from the carrier.
Okay.
So,
Yep.
Thanks, Shannon.
Thank you, Shannon is right.
Any other questions? Okay, Marlon, what if you want to schedule an appointment for MAPD in 2 weeks by phone? When do you enter the date of the appointment completed?
You'd put that future date. That appointment will not be completed, Marlon, until that future date. And that's what they're going to base everything on the scope, on the dates. Yeah, if you schedule that appointment for a week from Monday, I wouldn't do the scope until you got there. And the reason is because these electronic scope appointments that we send by text have a time frame to them. They're only good for 14 days. So in the event, like, you can schedule it just fine. You're perfectly good. You can go to the appointment or have that appointment come in, and that's when I would begin the process of your scope work at that time, the day they walk in.
Okay, and do the scopes automatically go to the carriers?
When necessary, they will go to the right spot. Most carriers right now aren't required to keep the scopes. The brokers are, or a system inside what the broker's got. And then unless there's a paper app where you've got like an Aetna or United Healthcare that already has the paper scope attached to it when you're doing it by like that, the scopes all get to the right spot when needed, and we can retrieve them when needed. So.
Okay, and Joran, can I write a MedSup and Part D from MedicareCenter?
Jordan, Part D is easy to do right from MedicareCENTER. I still personally would say MedSup, you're better off going directly to the portal. So if you do it at Ascendo, Lumico, you're better off going to the portal. You can quote it basically on MedicareCENTER. It quotes directly to CSG basically, but as far as the enrollment tool, you're better going to the portal.
Well, Luke, thank you. We're at 2:36. It took us
6
36
minutes
minutes. So folks, thank you very much, and we'll see you next time for the next webinar. I just tell everybody, mark your calendars. We're going to be working on the webinar that talks about A to Z seminar. We've got a guest coming in, Courtney Stowe from Humana, who's done many of these. In fact, a lot of brokers from about 4 states invite her in, and she's a wealth of knowledge, and she can take us to the next step of this, where we can be an influence to our community, where we're actually giving seminars out there. So we're looking forward to that one. Sign up, and we'll see you then.
Thank you, guys.